Bone fractures can occur in various ways, and there are several common types of fractures. Some of these include closed fracture, also known as a simple fracture. This type of fracture does not break the skin. The bone is broken, but the skin remains intact. Open fracture, also called a compound fracture. This occurs when the broken bone pierces through the skin, leading to an external wound. Open fractures have a higher risk of infection and require immediate medical attention. Greenstick fracture, common in children whose bones are still flexible. A greenstick fracture is an incomplete break where the bone bends and cracks but doesn't completely break. Transverse fracture. The break occurs horizontally straight across the bone, often due to a direct impact. Oblique fracture. This type of fracture has an angled pattern across the bone, resulting from a diagonal force applied to the bone. Comminuted fracture. In this type, the bone breaks into multiple fragments or pieces, which may be caused by high-energy impacts or crushing injuries. Compression fracture. Common in vertebrae, compression fractures occur when the bone collapses or is compressed, often due to conditions like osteoporosis. Avulsion fracture. This happens when a small piece of bone is pulled away from the main bone by a tendon or ligament, typically resulting from sudden and forceful muscle contractions. Stress fracture. These are tiny cracks in the bone caused by repetitive stress or overuse, commonly seen in athletes and those involved in intense physical activities. Pathological fracture occurs when a bone breaks due to an underlying disease that weakens the bone, such as bone cancer or